Cerebral palsy and birth injuries can have an effect on millions of children across the U.S. In this segment, sponsored by Harch Hyperbarics Incorporated, we are joined by Dr. Paul G. Harch to share how hyperbaric oxygen therapy is being used to treat these patients locally. And Dr. Harch, there is so much to talk about on this topic. Last time that you were here, we talked about how there are FDA-approved uses for hyperbaric oxygen therapy, and there are uses that go beyond that, where experts like you can help walk people through some of those utilities beyond those FDA-approved uses. This is one of those, and you have seen results in your patients, and we've seen research that shows this is effective.
Exactly. In fact, you know, the thing about the FDA approval, there are in fact multiple conditions that have greater evidence for effectiveness of hyperbaric oxygen than those that are on that FDA list. Funny way of how it all happened. But with cerebral palsy, in 1992, we treated the first cerebral palsy child treated in North America with hyperbaric oxygen. And it was part of a broad program to look at effects of hyperbaric oxygen on different types of neurological diseases. And this was a 4.5-year-old boy, low tone, drooling, couldn't eat, no speech, just a little Pinocchio-like kid who sat in a pile. And at the end of 2 courses of treatment, this child was walking with fingertip supports for balance. We have this on video. And it sparked then an application to this, and then multiple research studies. And a review of that finally published 2 years ago showing that this therapy is 4 times as effective as the average of all the typical therapies used for CP.
And I found this fascinating, you know, as a mom to 5 kiddos, I found this research to be fascinating. You sent us a graph. If we could pull up that graph real quick. This is the research compilation that you're talking about, showing that hyperbarics is highly effective compared to other therapies.
Yes. This is a study that went back and looked at all the studies used for treating CP children. Physical therapy, intensive PT, extremely intensive PT, Botox injections, stem cell administration, surgery where they cut the spinal cord to reduce tone, and therapeutic horseback riding, or horseback riding type of physical therapy. And what is shown by the graphs, what they're measuring is the motor function, and a motor function test that was done for all of these studies, therapies. And you see those 2 high bar graphs there. Sure. Those were the improvements in motor function in the children with hyperbaric therapies, the 2 different doses. All the rest of them, you see, are far less.
Yeah, and that's really cool, and a really hopeful message maybe to some families who are looking for some relief for children or adults who have some of these birth conditions.
Yes.
Talk to me about what success looks like, because I do know that things like cerebral palsy, autism, there are varying degrees to how these affect certain people. So I assume the success looks different in people as well.
It does, and it depends on your injury. If you look at that gross motor functional test, there are actually 5 different curved lines that show the levels of motor function these children have, or the levels of deficit. And so at different levels, like the lowest one where the child can't even crawl, they will see an improvement in crawling and an advancement up to the next highest level of function. So it's different for each of the levels, but it's proportionately roughly the same. But in addition, they'll see improvements in speech, in fine motor function, in balance, in socialization and interaction,
so
and
it's
cognition.
Helping the neurological condition of it as well. Tell me,
it's helping the whole brain injury.
Tell me, I know we've talked about this in other conditions that this treatment is used for, that it can help people even long after the injury has occurred. With something like cerebral palsy, it's usually diagnosed, what, around 12 to 24 months?
Yes.
But people live with this for the rest of their lives. When can you treat people? How late have you treated people?
Boy, that's a great question. The injury usually occurs at the time of birth, right around birth or shortly thereafter in premature babies. And all of these studies were done on children between 2 and 13 years of age.
Okay.
So the length of time doesn't matter so much, although you like to do it earlier. The earlier you can, the better. But in the last 5 years, I've had 2 62 and 65-year-old women. 62 and 65-year-old women with cerebral palsy who were able to experience improvement, cognition, spasticity, their gait.
Wow. So definitely something you want to check out. If folks want to learn more about this or speak to you about how your therapies could help them, what do they do?
The HBOT.com is the easiest way to remember it.
HBOT.com, we've got that right there on the screen. Dr. Harch, thank you so much.
My pleasure. Thank you.